Hello, and welcome to this LinkedIn Live conversation presented by Alterity ADR, a national alternative dispute resolution firm committed to the principles of diversity, inclusion, and human-centered data-driven design. Why are we here? Why did we invite all of you to join us for this broadcast today? Well, on September 9th, 2021, President Biden announced his COVID-19 action plan, part of which includes a mandatory vaccination or test plan for employers with 100 or more employees. Biden intends to accomplish this by directing OSHA to issue an emergency temporary standard. Now, we know that there are a whole spectrum of opinions on that for employees and employers. Some are lauding that, some are decrying that, many are upset, some are happy about it. There's already been a lot of pushback. We've already seen discussion of swift challenges by various groups. So we wanted to have a high-level discussion to sort through some of the noise and just help everyone prepare. I am going to ask the speakers to introduce themselves, and then we will jump right into our content. Amy, why don't we start with you?
Thank you, Shalanna. Good afternoon, everyone. My name is Amy Cisrow-Peterson, and I am the Assistant General Counsel of Rack Room Shoes Incorporated. I have been with Rack Room for a little over 16 years. I am the manager of litigation for our company, and I handle everything from the HR issues, anything dealing with CCPA, TCPA, you name it, employment issues. And I'm mainly getting involved now as we move into compliance with these new mandates and things that we have coming out due to COVID. So thank you.
Awesome. Thank you. Michael.
Thank you, Shalanna. And I'll say good morning to my fellow West Coasters and good afternoon to everyone else. So my name is Michael Thomas. I am a partner at Jackson Lewis in our Los Angeles office. And I've been practicing law for a little bit over 20 years, largely doing employment defense. My practice largely consists of a lot of wage and hour class action litigation, both in California and also nationally. And I'm excited for this conversation today, really in part because this regulation that's coming from OSHA is going to apply to a lot of employers that are just not used to dealing with OSHA. So a lot of employers that are manufacturers or warehouses, they're used to dealing with OSHAs, but law firms, we're not used to dealing with OSHA. OSHA might show up. So it's important really for us to have this conversation because it's going to impose some unique experiences and requirements for all of us.
That's right. Thank you for that. And I am Shalanna Pirtle. I am, I guess, the baby of this group, if you will. I've been practicing for 14 years. I'm a partner at the Charlotte-based law firm of Parker Poe Adams and Bernstein. I've spent the entirety of my career doing employment defense work, litigation, advice and counsel, from cradle to grave, all things dealing with the management side relationship. I also do a fair amount of diversity, equity, and inclusion work, not just for our firm, for which I'm serving as the interim director right now, but also for clients. I do a good bit of training on various DE&I issues. And I am also a certified mediator, and I am part of the Alterity ADR panel, and I am your hostess with the mostest for this conversation. So with that, y'all, we've got about 20 to 25 minutes of content. Please email any questions that you have to info@alterityadr.com. We will address those at the end, or any questions that we're not able to address live. We will do some sort of follow-up blog or article for you all as well. So with that, let's just jump right in. Michael, tell us who will be impacted. I know there are a lot of questions. There's a lot of, do I have to comply? Is my business? Just talk to us about compliance.
Yeah, so thank you for teeing that question up. So the cornerstone of the plan involves OSHA issuing a vaccine testing rule that will apply to all private employers with more than 100 employees, which is estimated to be about 80 million workers or 2/3 of the country's workforce. And this rule will take the form of an emergency temporary standard, which is an ETS. And that allows the agency to enact regulations. It can enforce immediately if there is a grave danger to worker safety that's present. And so their goal is to make sure that people at these large companies are either fully vaccinated or able to produce a negative test result at least weekly before arriving to work. And of course, one of the initial legal challenges is going to be, why 100 employees? Why doesn't that grave danger exist when there's just 99 employees at the work site?
That's right. That's absolutely right. So what happened? Well, let me ask first, is it mandatory? Now, that's a question that I've gotten from several of my clients. Do I have to comply? What happens if I don't?
Yeah, and that's a fantastic question. And so the direct answer is no. This is not a mandatory vaccine requirement. So you either have to show that your workforce is fully vaccinated or that your workforce is not infectious when they come to work by submitting themselves to weekly testing. And so your employees do not have to be vaccinated. This is not a vaccine mandate, but you cannot let someone come into your workforce that could potentially be infected with the virus. And so employers have always had a requirement to keep workers safe from hazards. And so here, the hazard comes from the unvaccinated or infectious worker. And so a vaccine mandate or weekly testing allows the employer to actually control that hazard. And so the other question that you raised, Shalanna, is what happens if I don't comply? And again, at this point, since the ETS has not come out, we don't have a 100% clear answer on what exactly happens. But so we'll have to wait for the ETS to get a full answer to that. But for those that ignore the ETS, you're likely going to face either OSHA citations, or you're going to face some type of penalty from OSHA that can range up to $13,000 to $14,000 per violation. And although it's currently unclear, this likely means that it's going to be a fine for each facility inspected by OSHA that does not comply with the ETS. And so one of the other things to kind of keep in mind is historically OSHA actually has been, somewhat forgiving for employers that take good faith efforts and really do try to comply. Historically, OSHA has been a little bit forgiving in those kinds of scenarios. It's unclear if OSHA is going to take the same exact approach here because there is this national emergency to really save lives.
That's right. So I want to underscore that for those that may have just joined us. So while you do not have to require your employees to be vaccinated, it's not a vaccine mandate in that sense, they're going to have to choose. They either need to be vaccinated or they need to produce a negative test on a weekly basis. It will be their choice. And yes, employers, you got to comply with the ETS once it's issued. If you don't, there will be some ramifications. How about how OSHA will count the number of employees that an employer has? Does that include those that are on leave or just those that are physically present in the work site?
Yeah, and again, that's one of those great questions that's not completely answered. So we're still waiting for the ETS. So it's unclear how that 100 employee threshold will be determined. But given other standards that mandate certain requirements based on employer size, the threshold likely will be based on the total number of workers employed by the company, period. But it's unclear if that count is going to be limited to one office or really nationally. It's unclear whether a joint employer analysis could actually apply. It's unclear whether it includes employees that are on leave. Since the ETS will focus on a specific location for workers that are working remotely, so they're not going to that location, it's unclear if the ETS would actually include them either. But, again, one of the kind of like big picture ways to think about this is that the mandate or the requirement for weekly testing is designed to save lives. So OSHA is likely to impose the ETS in a way that is as broad as possible to effectuate those results. And so one other thing that employers need to think about in terms of, just complying, I mentioned this really briefly at the intro, is that, again, there's a lot of organizations that are not used to dealing with OSHA. Financial institutions, law firms, other professional and even technical environments are not used to OSHA inspectors showing up. So part of this compliance piece is really going to be, how do you train your managers to talk to OSHA when OSHA shows up, at your work site? And then a couple of other small things that become really important is not only are you going to have to decide which of those two approaches are you going to take, mandating the vaccination or that weekly requirement, but how are you actually going to ask employees whether they've been vaccinated or not? How are you going to maintain those confidential records? And OSHA might even ask you to collect proof of vaccination, not just the honor system. What are you going to do with that proof? So there's a lot of things to figure out how to comply. But that 100 threshold, we're still waiting for some guidance on exactly how to come up with that.
And then finally, so a number of groups have already said that they are going to be filing lawsuits to try to challenge the ETS when it comes out. I think some may be attempting to challenge it now, although there isn't one actually in place. It's probably hard to do that. But how does that impact the effectiveness of the rule? If lawsuits are filed and attempts to challenge it occur, do employers still have to comply even in the midst of those challenges?
That's a great question. And my direct answer as a defense lawyer is comply. And to be honest with you, that's what most employers want. Most employers, want to protect their employees and protect the workforce, and they just want to know, what do I have to do to comply? So this is a broad sweeping policy, and the ETS is going to face legal challenges. So governors in many states have already said they intend to file different challenges. Even a court could even block enforcement of the ETS until these legal challenges are actually resolved. So that could actually occur. And so OSHA will actually have to prove that there is a grave danger to these large workforces to justify the imposition of the ETS. And that actually could be difficult for OSHA to actually prove. But in the meantime, as an employer, you do want to comply. You do want to protect your workforce. In some ways, there's an aspect of this that's actually not new because you've already had that obligation. This is just another hazard that you have to address.
That's right. Okay. All right. Well, I'd like to pivot just a little bit and talk about some of the things that our employers are most concerned about that may be a little more intangible, that aren't as easy as a do I comply or do I not comply question. So, Amy, what are some examples of issues that Rack Room has been thinking about while y'all have been mulling over the possible implementation of this ETS?
Well, let me start by saying I'm going to make sure we take Michael's advice and we are going to comply. For Rack Room, as for other national retailers, the biggest challenge is probably just going to be, how are we making sure that our customers are safe, that our employees are safe, while we're still able to maintain a large enough workforce to keep our stores open, to keep giving our services. With the vaccination, even though it's not a requirement, as Michael said, that you have to be vaccinated, it is an either or. That still is a lot of moving pieces for a lot of different stores in a lot of different states, especially when you have things like the governor may challenge it or things of that option. So just making sure that we are doing what we need to comply without sacrificing anything that we deliver to our customers.
Okay. What are some of the, I know y'all have, as do a number of national retailers, you've got locations around the country and numerous jurisdictions. How are you managing perhaps mentalities and attitudes towards the vaccine across jurisdictions, right?
So I think the biggest thing for us when you say that is consistency. And so what do I mean by consistency? Well, there's always going to be the thought in your employee's mind, is there a difference between headquarters and boots on the ground, the people out in your stores. So for Rack Room, what we want to ensure is that we are rolling the policy out to everyone at the same time, sharing the same information, explaining how this can work. Luckily for us, we are a little bit ahead of the curve. We have a great HR, so they've already been working toward making sure that as these things are even being discussed, that we are doing a preview of, hey, this is possibly coming for you. Then I think the other thing when you start to talk about the mentalities and the priorities is always just stressing that we are doing this as a compliance issue. So it's not that Rack Room wants to do this. It is what we have to do because it's being mandated. So hopefully that will get rid of their thinking there's some favoritism to any particular political ideals, any particular political agenda or anything of that nature. It's just, as Michael said earlier, nothing new. This is another OSHA requirement that we must comply with.
Okay. What about accommodation requests? How are you all thinking about and managing those? I'm sure that is the least of your worries.
So again, this comes back to probably you're going to be hearing these questions mainly from your HR or your operations. And what you want to do is look at this as you would any other accommodation. You want to ensure that you're going through the proper steps, that you're actually engaging with your employees and seeing what can be done as a reasonable accommodation. As you would any other ADA type of discussion, be interactive with your employees and make sure you're providing the best information. Then after you do that, you think about, so once you move past the ADA, what about the religious exemption? Because we're hear a lot of those. Same thing as you would for any other type of religious exemption that your employees are coming to. You just want to make sure that your corporate policy is solid, that you are applying it evenly, that you're once again doing an interactive discussion with the employee who's bringing or requesting the accommodation.
Michael, I want to ask you a question with, as a retailer, Rack Room has customers that come into the store that are going to be there on a transient basis, right? But then they also have vendors and suppliers who will, come into headquarters or may also come into the stores on a more regular basis. And other national employers may have customers, but not the sort of retail customers we think of, but the customers that they supply their goods to. Mm-hmm. Will the EPS apply to those individuals or that aren't necessarily employed by the Rack Rooms of the world, but they still have a regular interaction with them and their employee base?
No, so that's a great question. There's really kind of two ways to respond to it. One, it's unclear if the ETS will necessarily apply to them. There's a good chance that it probably will not, because it's just focusing on the employees. But OSHA regulations will apply to vendors, customers, things like that. And what I mean by that is that employers have an obligation to protect their employees from hazards. And that is hazards that come from third parties, whether it's customers or vendors. And again, that's something that's not really entirely new. So you as the employer, all the different things that you probably should have been doing already during the pandemic, such as social distancing, mask requirements, hand sanitizers, better ventilation, all those different things apply to your vendors and customers, right? Again, based on that same theme of saving lives, because this is a national emergency. So it's unclear if the ETS will apply to those third parties, but you as the employer, you already have an obligation to protect your employees. And that does mean, kind of imposing policies on third parties.
Okay. Amy, Rack Room may have been ahead of the curve and already had a vaccine policy, but to the extent you did not, how do you even start going about putting one together?
So I think, so similar to how I said consistency, I think here you also have to have communication being the key word. So when you're looking at the vaccine policy, I think it's first important to stress why it's being given, means explaining what the ETS and why we're looking at having to do this, and then how we communicate and explain the mandate as far as the relationship with our employees. So it's like any other relationship. Communication involves not just telling someone something, but listening as well. So I think that, we're going to hear this coming from the employees who are out in the field and helping to, one, debunk any of the rumors that they're hearing about this ETS. So giving clear, honest information. And then I think for us, the bigger challenge is going to be kind of on the logistical side. So Michael alluded to that. So if we have the people who are not vaccinated and are having to test weekly, that is a host of questions. Who's going to do the testing? Who's paying for the testing? Which tests are reliable? Who are going to, what results are we going to take? And then you have the vaccinated employees who are being told that if you get vaccinated and you have symptoms, you get paid time off. Well, how severe are your symptoms? How long is your paid time off? And why does Shalanna get time off for her symptoms, but I don't get time off for my testing? So there are some very large logistical pieces there, even to the tracking. How do we keep track of 800 weekly tests coming in from different facilities? So I think with your policy, the first thing you're going to want to do is obviously reach out to your wonderful outside counsel. And you're going to make sure that they work with your HR to formulate a policy that will allow you to apply it consistently, evenly to your stores or your manufacturing warehouses as you do to your headquarters. You're going to want to make sure that your documentation is being kept correctly and is up to par. You're going to want to make sure also that you are consistently reminding people and trying to at least give a reasoning for why this is happening. So again, no one likes to be told they have to do something or that some right is being taken away from them. So I think that by reminding them of the reasoning for this, and maybe even, I know some companies are looking at doing different type of incentives for vaccination. That's another way you maybe can start in your vaccine policy to pull more of your employees in. Again, running that by your outside counsel before you decide what, if any, kind of incentives you want to do. So that is, I think, with Rack Room, even though we have started our policy, is our communication is key, making sure HR is consistently reaching out and allowing for our employees to reach back with their concerns.
Fantastic. Yeah, you brought up a couple key points, one of which we already got a question about. We got a question from Evan as to whether weekly tests are at the expense of the employee or the employer. I think the expectation here is that it's going to be at the expense of the employer, but note that as a general proposition right now, tests are covered by insurance. And if you don't have insurance, they're just otherwise covered by the government. So I presume that that's not going to be lifted or modified anytime soon. But in the event that it is, that is a question that'll need to be answered by the ETS, and we'll just need to keep following closely for that.
I think just really quickly, just one other thing on Evan's question is the time that the employee spends getting tested, actually will likely be compensable time. So your wage and hour policies are going to apply to that time as well, on top of paying for the actual test itself. Yep,
that's perfect. Let me clarify, that question was from Vernita, not from Evan. Sorry about that. Michael, any other concerns that you're hearing about, issues from employers about this?
I think just maybe two others, just really quickly. One, and this is not a surprise, people will always try to game the system, right? By coming up with some creative way to get time off, or really just some creative way to kind of test the employer. So not only do you need to have those good, clear policies on accommodations, but you need to have a really credible HR to kind of process any of those complaints, because you might have to discipline an employee for trying to game the system in one way or the other. The other concern that you're hearing come up a little bit is you got to keep in mind that unions might use this as an opportunity to organize your employees. And so there's two things to think about with that. One is there actually might be an obligation to bargain with unions on which route you take, whether you go the vaccinated employee route or the weekly testing route. That could potentially be an obligation or a subject for bargaining. But at a minimum, you should be prepared for the corollary of that, which is to bargain about the impact of that decision that you make, even if you don't have to bargain over the initial decision. But the last part is that unions might use this as an opportunity to organize your employees under the guise that we can protect you against these employer-forced decisions. We as a union can give you a voice. So you got to be mindful of those things.
Okay, perfect. So thinking even further about compliance, I think if you hadn't picked up already, you need a policy, right? So if you don't already have one, folks, let's get one soon. Reach out to your outside counsel, work with your HR team, and in-house counsel if you have in-house counsel. If you don't, get the resources that you need, because you do want to make sure that you have a firm policy in place and that you're applying it consistently. And Michael's already mentioned, start thinking about how you're going to track employee compliance, right? One centralized repository is likely best, but what does that look like? Is that an upload? Is that having somebody walk a test physically into HR? How exactly are you going to do that? You just start thinking about that. Michael's also referenced that, yes, you're going to need to give vacation or some sort of leave time, whether you call it PTO, vacation, whatever, for people to be able to get the shot, as well as for them to be able to recover from side effects, right? And that's going to differ by state. Some states already have some requirements for that. You've got some FLSA requirements for that. Some may be more stringent than others. So you want to make sure you're being attentive to that. And then you need to be thinking about how you're going to handle the employees who do not comply. Are they suspended? Are they on unpaid leave? Are they going to be terminated after a period of time failing to comply? What is that period of time? Is it 5 days? Is it 10 days? Is it 14 days? These aren't easy answers, right? But you've got to start really thinking about this so that you're prepared and you're not caught flat-footed. I want to talk in just the few minutes that we have left real quick about the interplay with remote work and whether remote employees will have to comply with the ETS. So at this point, it's a little unclear. I think a number of folks would say it's not anticipated that if you work strictly from home, that you would have to comply. But if there's ever a time that you would have to go into the work site as an employee or would have to go to a third-party site, if the ETS is effective and is in place, then yes, those employees are going to have to comply. And as an employer, you're going to have to make sure that you're monitoring and managing that. Employers, you also need to be prepared to respond to increased remote work requests from employees who are potentially seeking to avoid vaccination, as well as seeking to avoid weekly testing. Some employers probably think the answer to this is to just forbid all remote work. That's not the answer either. You need to be very careful with that. For starters, it may be considered an accommodation for an employee who can't get vaccinated and for whatever reason can't undergo frequent testing. It might also be an accommodation for other medical needs as well. But the bottom line is you just need to be consistent with whatever you're doing on the remote work. Amy, Michael, thoughts specifically for employees. Amy, I think you said already, like, we want to make sure we remind employees this is not a personal attack against you by a rec room, right? We have to comply, so we're doing what we are required to do. Any additional thoughts from the two of you about how employees can get ready for this?
Well, I think one thing that you want to do, again, we've talked about, obviously, as employers, we're making sure we are doing good documentation, consistency on our policy. And I come back to the other really important thing, and that's communication. So I think that if you are looking at your vaccination policy, it's just vaccination policy, just you've got to do it or you won't, you're going to have a lot of employee pushback. But this is just another step in us trying to keep our employees safe, keep our stores open, keep our customers safe. So this is going along with everything else, from social distancing to possibly having to wear masks, reminding people about all the other things, the hand washing, and this is just the next layer of safety. So I think as you start to work with employees on that, again, the engagement on any type of request for an accommodation, like you say, you just can't say no, that you can't do teleworking. the engagement to be able to help people understand that maybe if we are going to go to teleworking and we were looking at having to bring you in and you get tested, being able to do more things like this, more Zoom meetings for a while, more on-camera meetings, so that those employees know that there are other options, and making sure that your HR, like I said, our HR is really good with this, is consistently reaching out and asking, do you understand why this is happening? Is there something that we can do that can help bring along your decision and in helping to alleviate, which may be some of the hesitation that your employees are having?
Mm-hmm.
And I think Amy stole my thunder. because I think the only like additional thing that I would say for both employees and also the employer is that, this mass mandate or weekly testing is not designed to be like the answer. It's part, because we know vaccinated people can contract COVID and transmit COVID to other people. But the reason I mention that is that this vaccination mandate, whatever you want to call it, does not displace current compliance duties that already exist for COVID prevention that both employers and employees have to comply with. And this is what I mean, where Amy stole my thunder. The social distancing, masking, sanitizing, other safety steps, you're already required to do under OSHA, CDC guidance, or even local and public health ordinance and regulations, right? So employees keep doing that to keep each other safe, and employers keep doing that because that's still part of your obligation. And part of that is OSHA might be showing up to your work site. So we keep talking about having that plan, but one of the things that's going to be important is that when OSHA shows up, you do have that OSHA readiness plan that should include things that you are already doing, right? So for both employers and employees, there's a lot of this that is in some ways is new, but some of this is we've already should have been doing in the first place.
That's right. I'd also offer to employees, if the ETS is implemented, it's effective, it survives challenges, you need to be prepared. To those unvaccinated employees, you need to be prepared to either decide to get vaccinated or just get in line with having to do the weekly testing, get ready for that, plan for that, make appointments weeks in advance. And if you choose not to do that, then be prepared that you very well may wind up losing your job, or you may keep the job, but you may wind up being unpaid and put on leave or be suspended for an extended period of time. So I just don't want anybody to be caught flat-footed. I want everybody to spend some time thinking about that and preparing for that, because that'll be the best way, I think, to save a whole lot of heartache and frustration for everybody. Amy, Michael, as we begin to close this out, do you all have any thoughts about the role that ADR practitioners can play in this space, particularly in this kind of very, COVID-rich, highly charged, sensitive, emotionally charged environment?
So you took the words out of my mouth in the fact that that's the environment that we're in. And I think that is where we need someone like yourself or someone in the middle who can help us understand that everyone doesn't live in Charlotte or New York or LA where there are 200 testing sites. Maybe you have employees in smaller towns. There's one testing site. There's, that weekly test is going to overwhelm these small towns, possibly with the one testing site where everyone's got to go to the same place. But we still need our employees. We still want you to fulfill our duties. So I can see where there is going to possibly come an impasse where we are trying to decide how much is a reasonable accommodation, what is reasonable, and when has this become an undue burden on the company. And because of these highly charged, highly polarized beliefs, I think that to reach a amicable resolution on that is going to require a little bit more than just possibly a conversation with us. And that's why I see ADR being extremely useful.
Yeah, no, and I would really piggyback on that. And I have a lot of thoughts on this subject. But I think ADR practitioners have the benefit of being able to hear both sides, get both sides to honestly hear each other, to engage in a meaningful conversation and to create a resolution together. And that becomes important, in our current political climate. And I'll kind of harken back a little bit to other aspects of discord. And what I mean by that is, we're at a point within our political climate that has spilled into the workplace where, things that were historically just disagreements, where you can talk to each other about something, we get into the stage of bad othering, where instead of I just disagree with you, you're a bad person. So it used to be, for example, you had the Black Lives Matter movement, racial awareness. So more employers responded to that. Then you had an executive order that said you can't do sexual harassment training or racial awareness training that touch upon certain issues. So that type of conversation went from let's just talk about this issue to you're a bad person if you believe this, you're a bad person if you believe that. It's taking that same exact framework, applying it to the vaccine. It's fundamentally about trying to keep people safe as we work through this pandemic collectively, because we all want to go back to some degree of normalcy. But instead, the conversation is, if you believe a certain way, you're a bad person. If you believe a certain way, you're a bad person. And when you're in those positions, it's hard to actually hear the other person, right? So ADR plays this fantastic role of really getting both sides to that place of, I can hear you. I'm no longer saying that you're a bad person. I might disagree with you, but I understand what that position is. And let's come together and reach a resolution where we can all come together and work cooperatively, keep employees safe, and get our economy going.
That is a fantastic place to end. Wonderful. Yes. I know that we've gone over just a few minutes. I'll note we got 2 more questions from Evan about whether an employer can be sued if an employee is harmed by the vaccine because the employer required the vaccination. I think the answer to that is going to be no, although I'm certain that there will be lots more discussion around that. And then also whether we know what tests will be acceptable, rapid test, antigen, PCR. We're waiting on the issuance of the ETS before we can answer those questions specifically. But with that said, thank you all so very much for joining us. Amy, Michael, thank you for participating in the conversation. You have given invaluable thoughts and guidance on this. And this is just the beginning. We have a lot more to go, because there will be a lot more to talk about once the ETS is actually issued, and we can see if it's going to be challenged, are the challenges going to stick, and whether this is going to be implemented in practice and with us for a while. So with that, if you have any follow-up questions, please email those to us at info@alterityadr.com. We will address them in a subsequent post. We look forward to bringing you many more fresh topics and conversations from Alterity ADR. Check out the panel, please, for all of your neutral needs. You can also find Amy, Michael, and myself here on LinkedIn. With that, thank you so very much for joining us. Have a wonderful day, and be safe, everyone.
Yeah.
Thank you. Thank you, everyone.
Thanks, everyone. Be safe.
Bye-bye.